Hey everyone, and welcome back to the CES Experience, where we dive deep into the systems shaping our world through conversation, storytelling, and a little bit of critical thinking. I'm Magnus.
And I'm Nazri. Thanks for tuning in to episode 3. If you've been following along, you know we've been exploring healthcare inequality in the United States, why it exists, who it affects most, and what can be done about it.
Today's episode is a real special one, folks. We had the chance to sit down with Dr. Manish Patel, a physician with years of experience working at the intersection of medicine and public health. His insights into the structural challenges within our healthcare system were eye-opening.
Absolutely. From the impact of insurance access to the ways geography and race shape health outcomes, Dr. Patel gave us a lot to think about. Whether you're new to this topic or already knee-deep in healthcare policy debates, this is an interview you won't want to miss.
So let's get into it. Here's our conversation with Dr. Manish Patel.
How would you define healthcare inequality from your perspective as a medical professional?
From my perspective, healthcare inequality really has to do with the inequities in access to care, which have to do a lot with socioeconomic status from different individuals who, because of, for a variety of reasons, that don't have access to care. This disproportionately affects people of color, African Americans, Native Americans, and other people.
In your experience, what are some of the biggest factors contributing to unequal access to healthcare?
We have a system of healthcare that lends itself to having some inequities. The fact that many people are not eligible for health insurance if they don't have a job certainly is one big factor. Another big factor has to do with some level of mistrust by some groups of people with the healthcare system, which have to do a lot with some history of mistrust among the African Americans towards the healthcare profession. Those are the main factors.
How have historical events impacted trust in the medical system among the BIPOC communities?
There are several examples of historical events that have created a situation where many people of color do not trust the healthcare system. I think probably the most famous is the syphilis study of the Tuskegee Airmen, where patients were not given adequate treatment for syphilis amongst the African American regiment. In addition, there have been numerous examples of Native Americans not having access to health care or have been neglected because of their skin color. And I guess one other example was the use of patients' cancer cells for research that was never disclosed to the patient. This was a case of Henrietta Lacks, who her cells were used without her permission and led to so many important discoveries, but she was never credited for any of that, even though it was never consented to do this. So several things in the healthcare system have been applied to people of color without regard to common ethics that are used amongst more affluent or Caucasian populations.
Have you ever witnessed or been trained about racial bias in diagnoses or treatment within healthcare settings?
At the University of Minnesota, we are required to undergo annual training for the last I think 6 years to undergo annual implicit bias training, and this has now been instituted on a regular basis for really all medical care providers, physicians, trainees as well.
Are there examples of common misconceptions or stereotypes in medicine that you believe harm BIPOC patients?
There are many stereotypes that have resulted in some problems taking care of patients with that are people of color. I think certainly there are many physicians who can have sort of implicit biases about when they see a African American patient, that they might assume certain things like they are poor or maybe don't have education as some other patients might, and that does lead to people approaching their care in a different way. Certainly, patients who don't speak English, I think, have there's a certain expectation, or there might be some implicit bias that those patients may have relatively low healthcare related education. That may lead to some people treating them differently.
How does insurance coverage, or lack thereof, impact the quality of care that patients receive?
The lack of health insurance in this country is a big problem for patients. Even well-intentioned physicians have a hard time providing care to patients who don't have insurance, because they just don't have the ability to pay for the goods and services that they need to receive for good health care. I think lack of insurance also does lead to some degree of, what's the word I'm looking for? Nihilism amongst healthcare providers, that they don't feel like they can really provide good care, and so sometimes end up neglecting things that shouldn't be neglected, simply because the patient cannot afford to pay for it.
What steps has your hospital or practice taken to reduce bias and promote health equity?
At our institution, we have instituted, as I mentioned before, implicit bias training for all providers. There is a general concept in our healthcare institution that we do not, the healthcare providers who are providing care don't directly deal with medical insurance providers, and make our treatment recommendations really without consideration of the patient's health insurance status. Now, obviously, we become aware of it if we can't do the things that we recommend, but generally speaking, we see and document the care of the patient regardless of what their insurance is, and that's generally standard practice within our institution, which I think is different from other places. They do have and have had many efforts to improve the care of persons of color. Certainly, patients who don't speak English are mandated to have a medical interpreter for their care, and that also helps with the communication barriers.
That was Dr. Manish Patel sharing some powerful insights on the realities of healthcare inequality in the U.S. If you're anything like us, you're probably still sitting with some of the things he said.
Yeah, there's a lot to unpack, from systemic barriers to how we as individuals and communities can push for change. If today's episode sparks some thoughts, questions, or even frustrations, we'd love to hear from you.
You can reach out to us on social media or in person at Central High School. And if you found this episode meaningful, don't forget to subscribe, share it with a friend, or leave us a review. It really helps us keep these conversations going.
We've got more episodes coming soon, continuing our deep dive into health, equity, and the policies that shape our lives. Until then, take care, stay curious, and keep questioning.
Thanks for listening to the CES Experience. See you next time.
And stay tuned for more.